Eat breakfast like a king, lunch like a prince, and dinner like a pauper. Turns out this proverb has science to support it. In this 2013 clinical trial, overweight women with metabolic syndrome were randomized into two groups, the big breakfast group and the big dinner group. Both groups consumed the same amount of calories, but one group consumed half of their daily calories at breakfast time, eat breakfast like a king, and the other group had what I think is a more common eating pattern, where that bigger meal that was half of their caloric intake for the day was dinner. Lunches were the medium meal and were identical between both groups. So it was really just a swap of is big meal breakfast or is big meal dinner, with a light meal being the opposite one. And they did this for 12 weeks. Now, both groups lost weight, but the big breakfast group lost more weight and had a greater reduction in waist circumference. Both groups saw improvements to fasting glucose, fasting insulin, as well as the glycemic response to an oral glucose challenge test and the glycemic response to a meal. But the big breakfast group saw bigger improvements. And this is what that looks like graphically. At baseline, before the 12 weeks of the clinical trial, both groups had insulin resistance. At the end of the 12 weeks, both groups had normal glycemic responses, but the big breakfast group has substantially healthier blood sugar responses. Some other cool benefits: triglycerides dropped 33% in the big breakfast group, but increased by 14% in the big dinner group. And the big breakfast group were less hungry. They had lower levels of ghrelin, the hunger hormone, lower levels of perceived hunger, and higher levels of perceived satiety. This 2012 clinical trial in non-diabetic, sedentary, obese men and women did something very similar, but with like an extra interesting bit to add to the big breakfast conversation, which is that the group who ate the small breakfast also were eating a low carb breakfast, and the group who were eating the big breakfast were eating a high carbohydrate, high protein breakfast that included dessert. The study participants got to choose between cake, cookies, chocolate, ice cream, chocolate mousse, or donuts. And the coolest thing that this study adds to this conversation is that when that big breakfast is also a high protein, high carb breakfast, that reduces weight regain. Both groups lost weight during the 4-month-long main intervention of this clinical trial. But in the subsequent 4 months, the small low-carb breakfast group regained most of that lost weight, whereas the big breakfast that includes lots of carbs and protein group continued to lose weight. So yeah, there's some cool studies to support the overall eating pattern of a big breakfast and a light dinner.